So thank you very much for joining us today. If you're just logging on, welcome. Today's webinar will last approximately 1 hour. It will be recorded and shared with all the registered participants. So welcome to all of our guests and panelists joining us from around the globe. My name is Tess McLeod, and I am a policy advisor on the People Health Planet team with Population Reference Bureau's PACE project. I have the pleasure of moderating today's webinar, part of a series intended to highlight current trends and topics in population health and environment. Today, we will hear from 4 expert panelists from across government, academia, and civil society about innovations and investments being made in Tanzania towards multisectoral development approaches in population health and environment. As we hear from our panelists, we invite those of you attending to submit any questions you may have in the question and answer feature, and we will take time to address them at the end of all the presentations. PRB has been advancing integrated population health and environment approaches to development in concert with development partners in Tanzania since 2007, when we helped launch the Tanzania National PHE Network, and soon after published a policy brief that looked at the history and potential of integrated population health and environment interventions in Tanzania. Today, we'll hear the newest developments to highlight across the country towards building sustainability and cross-sectoral collaboration to address development goals and strengthen resilience. Next slide. Evidence suggests that holistic, multisectoral approaches to development, especially those that include reproductive health, can yield better outcomes than single sector approaches, enhancing community buy-in and raising standards for health in people and the planet. In this way, communities not only build healthier futures for themselves, but ensure adaptability to unanticipated changes in their environments, such as disease or climate-related impacts. The approach to development, known as Population Environment Development, or PED, focuses on meeting the needs of rural communities while enhancing natural resource management and conservation, leading to holistic development. PED emphasizes bringing conservation and reproductive health care simultaneously to communities that both need and want them, particularly those that live outside the reach of healthcare systems on the edge of some of the world's most valued and endangered natural ecosystems. Over the years, these multisectoral projects have demonstrated that implementing a comprehensive and integrated strategy that builds upon existing synergies between health, family planning, and the environment is more efficient than implementing sector-specific programs. Next. Tanzania has a long history of engaging in PED projects, dating back to the start of the Jane Goodall Institute's Takari program in the mid-1990s and the Success Project near Sadani National Park in the mid-2000s. In addition, the Nature Conservancy, Pathfinder International, and local government partners launched the Tungane project in Western Tanzania in 2012. Our focus during today's webinar is on new PED efforts in Tanzania, but we thought that this short video about the Tungane project would set the stage well for our discussion.
The only way to get to this village in remote western Tanzania is a long boat ride across Lake Tanganyika, the world's longest lake, and almost a mile deep. The village sits at the feet of the Mahale Mountains, where the steep tropical forests are home to East Africa's largest chimpanzee troop. Lake Tanganyika holds more fresh water than Lake Michigan, Lake Superior, and Lake Ontario combined. Evolving in isolation, the lake's unique species include freshwater jellyfish, sponges, and more than 200 species of cichlid fish. There are few places at this scale left in the world for conservation. A largely intact ecosystem with a globally significant cache of species, where we still have the chance to get it right before the scale tips. But imagine you're a woman living on the lake's isolated shore. To provide for your 6 children, your husband fishes in the lake, while you farm a small plot of land near the forest. But recently, fish stocks have been declining. This area has one of the highest birth rates in the world. So more and more fish are being hauled out of the lake with destructive fishing gear to feed the growing villages. And more forest is cleared for farming, sending sediment washing into fish breeding sites. To solve these intermingled challenges, the Nature Conservancy, Frankfurt Zoological Society, and reproductive healthcare organization, Pathfinder International, took partnership a transformative step forward in 2011 with the launch of a project called Tuungane, which means let's unite in Swahili. Already we're helping to bring back the declining fish populations by providing training and better equipment. Conservancy scientists are mapping fish breeding areas and helping communities to designate no-take zones. And we're reducing the pressure on the lake by providing hundreds of people with family planning care, education, microfinance projects, and more. We launched Tuungane project with an eye from the very start towards scaling up across the entire lake basin, which sustains some 12 million people in the 4 countries that border the lake. To pull this off, we're drawing on expertise forged over decades by TNC's US Great Lakes Program and other whole system freshwater projects. And we're working with a basin-wide conservation coalition that includes leading institutions like the John D. and Catherine T. MacArthur Foundation, linking up freshwater conservation and human development efforts and investments creates enormous opportunities to accelerate meaningful impact at the system scale as we address what matters most to nature and people. That's the promise of Lake Tanganyika and Tuungane.
Okay. Thank you. As we've seen, integrated projects that seek to achieve health and other development goals simultaneously help boost resilience, a vital need as we face compounding crises in the form of climate change, COVID-19, and conflict across the globe. Research using data from the Tuungane project has helped to underline the value add of integrated approaches, especially the inclusion of maternal health and family planning in enhancing resilience. What makes households and communities resilient in the face of shocks? Here are 8 key components of resilience identified in a 2018 publication in the journal Population and Environment that focused on household and community level resilience in the Tuungane communities in rural Western Tanzania near Mahale Mountains National Park. The study looked at factors associated with resilience to understand how communities in ecologically rich rural regions, where people rely heavily on natural resources, approach coping with shocks. The research team identified these 8 components to create a model for resilience. In addition, the study analyzed the association between family planning, maternal and child health, and each component of the resilience model, finding there was a significant positive association with nearly all components. Most importantly, when family planning by itself was analyzed against the components of resilience, the study found a strong and significant association between family planning and resilience. Next slide. Today, we will hear from 4 leaders in population, environment, and development in Tanzania. First, we will hear from Judith Ngora, Senior Economist with the Ministry for Foreign Affairs and East Africa Cooperation, as well as Coordinator of the Lake Victoria Basin Commission. Judith will speak on Tanzania's National PHE Strategic Plan and the history of PHE in the East African community. Next, we will hear from Dr. Matthew Senga, Senior Lecturer in the Department of Sociology and Anthropology and Population Studies and Research Center at the University of Dar es Salaam, where he also serves as Research Grant Coordinator. Dr. Senga will discuss the university's newly developed master's program in population health and environment. Then we will hear from Angelo Kihaga, Program Manager for Pathfinder International, managing the Endangered Ecosystem of Northern Tanzania project, to share the project's integrated approach and results. Lastly, Emmanuel Mtiti, Senior Director of Policy and Programs with the Jane Goodall Institute, will share on integrated approaches to biodiversity conservation and health promotion through the Landscape Conservation in Western Tanzania project. As the panelists share their presentations, thank you for sharing any questions you may have in the Q&A box, indicating to which panelist your question is addressed. We will wait until all panelists have presented to address questions at the end. Now, without further ado, I would like to pass the floor over to Judith Ngora. Judith, the floor is yours. And next slide, please, Alfred.
Thank you, Tessie. Thank you so much for a very good introduction. I will just go straight. Actually, you have helped me to some of the talking points that I've been preparing to talk on the history. So I'll just be brief on the PHE history in the United Republic of Tanzania. As you have introduced me, I am Judith Ngoda from the Ministry of Foreign Affairs and, oh, sorry. Can I go on? Yeah.
Yes, we see you now, Judith. Please go ahead.
I'm Judith Ngoda from Ministry of Foreign Affairs and East African Cooperation based in Dodoma, National PHE Coordinator and Lake Victoria Basin Commission Coordinator, Senior Economist. I'll just go straight into the history of the PHE in the United Republic of Tanzania. The approach actually was introduced early in 1990s based on the high unmet need of the family planning and its reowned biodiversity. The Institute of the Jane Goodall Institute, who I hope we are going to hear today, has used the PHE approach in their work since 1994 and have been several PHE approach both on coast and in the west of Tanzania forests over the years. The Nature Conservancy and Pathfinder International we're also here today, and other partner in 2012 launched the Tungane project. This Tungane project focused on the behavior change approach, which seeks to change perception, beliefs, and practice regarding the use of natural resources, including land, forestry, wildlife, fisheries, etc. So in 2009, East Africa Population Health and Environment Network, PHE Network, which included the Tanzania PHE Network, it took a shape on a conference convened by PRB and LAM in Lem in Ethiopia. In concert with the participation from the representative from Vice President Office in Tanzania and the University of Dar es Salaam. So this network in 2014, it was officially launched by reinvigoration of the former network member of 2007. And this is because there was a need of adding new members, of which it was through the need from the East African community. So the coordinator was Minister of Foreign Affairs, and some of us may be wondering why, when we talk of the issue of population, we was expecting to hear a Minister of Finance and Planning, the Minister of Health, the Minister of Environment or Vice President Office. Minister of Foreign Affairs has been given the role of coordinating just because it was the ministry which is coordinating EAC issues, East African community issues in Tanzania. And this is not only in Tanzania, it is also in all partner states in the East African community. So that is where PHE came into force in the context of East African community. So when we talk on East African community, how the PHE was taken, or it was being geared on, it is through the Sectoral Council of Ministers for Health, which is the council convening for the Minister for the Health for all participating partner states. East African Community is a regional intergovernmental organization. It is comprising of the republics of Burundi, Rwanda, Kenya, Uganda, Southern Sudan, and the United Republic of Tanzania. So under East African Community, to have the institution, which is called LVBC, it's the Lake Victoria Basin Commission, established in 2012. And it is a specialized institution of EAC, which has been given a role to coordinate the sustainable development and management of Lake Victoria Basin. So through LVBC, with the support of USAID, designated an integrated PHE program. A PHE program is among of a lot of projects and programs that have been coordinated, almost like nine projects and programs under LVBC. But this LVBC program, it is the one which has been coordinated under the LVBC and also in East African community. LVBC facilitated the establishment of the reinvigorated national PhD network. That's why we have seen that on 2014, it was officially launched in all 5 partner states. So you will find there is a national coordinator for this PhD in all the 6 participating partner states in East Africa community. It is just because the idea was every PhD activities is given in a given country of EAC is to be reported to the national PhD network, and the same will also be reported at the level of LVBC and East African community. So in 2016, we, as a regional, the East African community launched the EAC integrated PhD strategic plan. It was launched in 2016 through the Lake Victoria Basin Commission ministerial meeting. I think it was in November. So as one of the regional with the world's fastest growing population, the EAC is fast losing its biodiversity due to the changing of human habitation patterns, overgrazing, deforestation, population, unstable exploitation of natural resources, biopiracy, and introduction of invasive and alien species. So these changes in the environmental characteristic associated with the exacerbation of the negative impact of climate change. So the EAC policy organ approved the implementation of this PhD approach as a regional approach for sustainable development. Now that is where the decision from the Council of Ministers, the Council of Ministers actually are the all decision which has been made from the sector council meeting or from all the EAC institution and organs is the one who has the mandate to direct other partner states to implement or any other decision. So through the EAC Council of Ministers, it's directed that all partner states, they should domesticate this regional strategic plan to their national. That is where Tanzania had its initiative to start developing the national strategic plan.
Judith,
Now,
I'm so sorry. I'm afraid we're out of time, so I'm going to have to stop you there. I do apologize. But if we have time, we'll circle around in the question and answer section and conclude some of those thoughts. All right. Thank you so much. Thank you so much, Judith. Wonderful. In the interest of time, I'm going to pass over to Dr. Matthew Senga of University of Dar es Salaam. Matthew?
Yeah, thank you very much, Tess, for actually this opportunity just to share a very brief, reflection on the experience of, our program, which is Master of Arts in Population Health and Environment, the University of Dar es Salaam. And I have to be honest here that we have not yet launched this program. It's still in, approval stages, last stages at the university level, and then at the Tanzania Commission of University, as it is required by most of the programs that we teach at the university. So I'm sharing this because I was involved in, development of the program itself, but also I've been one of the members of the, National Task Force on PhD, as Judith, said. So I will just talk briefly about 4 main aspects. First of all, an overview process of itself of the program. But secondly, how does the program itself fit with the PhD strategy, but also lessons learned from implementation, development of the program itself, but also the next steps for rolling out the program. So very briefly, the program, Master of Arts in Population Health and Environment, aims to train students on applied analytical, but also management skills on population health and environment. As you know, we target personnel from government itself, but also non-government organizations, national, regional, and even international, agencies, which are currently implementing, or maybe they're about to implement PhD programs in Tanzania. But it was developed out of justifiable demands. We did some consultative meetings with, various stakeholders in the process. They include also Pathfinder. So we really appreciate for the contribution by Pathfinder itself. UNFPA, National Bureau of Statistics in Tanzania, but also the President Office together with the Ministry of Health, which is now Ministry of Healthy, Community Development, Gender, Elderly, and Children, and also Ministry of Labor, Employment and Youth, and together with the University of California, Berkeley. So they contributed significantly into, various, issues with regard to how to set the program. And in terms of fitting with the PhD strategy, the philosophy of the program itself is to advance the so-called new frontiers of PhD knowledge. I think, we lack knowledge behind the PhD itself. We've been implementing a lot of things in isolation, population, health, and environment. So we need to enable Tanzanians and also people from other nations to cope with the new dimensions of PhD approaches in the increasingly globalized world. So this is in line also with the so-called, Tanzania PhD strategy, as Judith has said. So we need to produce high-level manpower, champions, and leaders who can integrate, PhD variables into development issues and also budgets. So it's in line also with our university's vision, which is 2061. Which promotes also expansion and also modernization of postgraduate training. And currently, there are several universities, I think in the world, that offer PhD curricula, some in South Africa, for the case of Africa, but also Europe, North America, and Australia. But for the case of East Africa, actually, Tanzania, and especially University of Dar es Salaam, will be one of the pioneers, actually, to this kind of program. But now we intend to use a total of like 22 lecturers, senior lecturers and associate professors. And also we target students with an overall GPA at bachelor level of 2.7 in the field of, population, resources, and development, and the related ones, to PhD itself. And also the development process, as I said, encompasses, key actors in various sectors which are central to PhD. And in terms of the next steps, for rolling out the program, we are waiting, as I've said before, the final approval of the university governing body before we send the program to TCU, which is Tanzania Commission of Universities. But we anticipate to start with 20 students when we launch this program. Actually, we are late a little bit because the current enrollment now targets students who will start next year. But we are trying to see the possibility of the university, if at all it approves, at last stage, because it knows about the program. Then we start with 20 students, but we aim to increase the number of students as years go by, and to have a total of maybe 200 students who have graduated from the program by the year 2024, 2025. So thank you very much, Chase. If there will be any kind of questions later on, I'll be able to respond to the same.
Thank you so much, Dr. Sanger. That sounds like a fascinating program, and I'm sure we will get some questions on it. Wonderful. I will pass the floor over to Angelo Kihaga of Pathfinder International. Angelo, on to you.
Thank you, Tess. My name is Angelo Kihaga. I work for Pathfinder International as the program manager for Arusha and Manyara regions. Today, I'll be presenting an overview of the endangered ecosystem of Northern Tanzania ENT project. One of the projects taking place in this landscape. Specifically, this project is being implemented by the Northern Tanzania Ranger Initiative Consortium of organizations and operates around the Tarangire National Park ecosystem. Next. The coverage of this presentation is as stated on the slide. I'll take you through the project overview. Then looking at ENT partners, then ENT partners platform, then Pathfinder PhD model. Later, we'll see the key project results. Then last but not least, I'll take you in the discussion on success, challenges, and lesson learned. Next. The coverage of this the endangered ecosystem of Northern Tanzania project covers over 40 villages surrounding Tarangire National Park, as the map portrays on this slide. It is a 5-year project supported by the USAID. The project is ending in the year 2020. The goals of the project are to secure ecological and economical thriving landscape that support people and wildlife. This project also aims at protecting critical wildlife movement areas and calving areas. We also aim at looking at diversity, diversing natural resources, livelihood, and create resilient human and definitely resilient communities. Next. The following slide presents the project objectives, just like we know, population growth, changing social values and the structures and climate change impacts are causing increased the pressures, resource scarcity, and conflict. So the project is aiming at restoring a thriving landscape that supports both people and wildlife, and its resilience to future stress from the climate change. Next. This is an interesting slide which portrays partner roles and focus. As you can see from the slide, the number of partners who are working under this project with their respective role. For instance, in a nutshell, let's see some partner intervention under this project. The Nature Conservancy does support the coordination of the existing integration. Pathfinder does integration of family planning into model BOMA and community conservation banking. We can see Maria City initiatives taking a role in policy and bylaws. The other organizations like OCOS have been doing some interventions on it, like probably you can see other interventions on the slide as it have been presented. Next. Health integration has been done by using various platforms, like how this slide discusses. For instance, TNC help out in integrating health in its platform. For instance, the coordination of Tanzania, Northern Tanzania region, example, help in creating the reproductive health committee in the consortium. Other partners like Honeyguide have been helping in disseminating issues of health on its platform, like the community wildlife management areas or protection teams. Oikos work with entrepreneurship groups, returning groups, whose members also work with Pathfinder as community health workers. So you can see how various partners have been involved into doing various health programming on the slide. Next. This slide speaks about the Pathfinder PHE model. PHE stands for Population Health and Environment. And basically the project is through Pathfinder and the Minister of Health, Council of Pathfinder and the Minister of Health with the health management teams in districts, train non-health staff on PHE. There have been scheduled sessions on family planning, PHE to all ENT partners like the women beekeeping groups, the village game scouts and resident committees, the wildlife management area committees, the crop protection teams, and women leadership forums groups. During the trainings, these groups are taught the planning at large. For instance, you can see in a picture, CHWs are in their session. Next. On this slide again, we can see another Pathfinder model, and this is about the community conservation banking as one of the platform. Community conservation banking, or COCOBA, is a type of village saving and loan association groups where members are encouraged to buy shares and taking on. COCOBA emphasizes is not only on buying weekly shares, it also make an emphasis on health living by understanding or using family planning and doing health and sanitation practices in taking care of natural environment, like planting trees. To date, COCOBA have collected a total share worth $218 million, which equals 99,000 USD. Out of nearly 2,000 members for COCOBA in this landscape, of 500,000 members. Another model under Pathfinder intervention is the model BOMA program. Basically, it is a voluntary program whereby through ongoing training, a household volunteer to be an exemplary and is encouraged to meet even positive population health and environment criteria. These are grouped into health, terrestrial, livestock, and integration. The portrait of the BOMA on this slide shows greenhouses, pit latrine, tip tap, local and planted trees, rubbish pit, living wall and the saving stock, manageable number of livestock, and so forth. These are some of the model BOMA criteria. To date, the project has recorded a total of 1,538 BOMAs in the landscape, compared to the projections we had of 1,500 in the beginning of the project. Next. Next. On this slide, we see results for intervention on family planning. We learned that the figures for family planning uptake have increased from 17,000 clients saved in 2015 to 66,000 clients saved to date. This indicates that the unmet number for family planning are being met. These have been an increase of over 40,000 clients for OFP interventions. These interventions are the health facility family planning provision, mostly long-acting and reversible contraceptives, and the short-acting method. Community health care workers who provide condoms and pills and other necessary referral for long-acting methods. And through routine mobile outreach services, in mobile outreach, again, most long-acting reversible contraceptive plans and short-acting methods are being provided. The end of this provision in this landscape show that women are accessing care not only at the facility level, but also in the community where they live and work. Next. On this slide, we see a number of challenges have been identified through the implementation of this project. The project has been responding to climate change adaptation even at a household level. Through model intervention, the household or BOMAs have been encouraged to not only adopt the positive health and the sanitation behavior, but also adopt the positive environmental behavior like planting trees, use of energy saving stove, observe the village land use plan, or engage in environmental friendly micro enterprise. We can further learn that the project meets the high impact clients. Our family planning clients in this landscape are also helping out in environmental conservation in Tanzania National Park ecosystem. This is done through a strong community conservation program is taking place in this landscape, like management of community wildlife management area in project villages. Next. This marks the end of the presentation. I'm available to respond to questions or give clarifications to areas need my clarifications. Kindly to submit, and thank you for listening. Thank you.
Thank you so much, Angelo. And I encourage anyone who has questions about the project or the presentation to enter them in the Q&A, and we will address them at the end. Thank you so much. I will pass the floor over now to Emmanuel Mtiti from the Jane Goodall Institute. Mtiti, the floor is yours.
Thank you, Tess, and welcome everyone. I'm Emmanuel Mtiti, as I've been introduced, and I'm from the Jane Goodall Institute. Next slide. Our history starts with Jane coming to Tanzania in 1960 to start a long-standing research on chimpanzees in Gombe National Park. And then as she was working around Gombe, she observed the rapid deforestation around in villages around Gombe. So she came up with an idea to start the Roots and Shoots, which is a youth environmental movement in schools. But that wasn't enough. So in 1994, the Jane Goodall Institute started the Takare, which is known as Lake Tanganyika Catchment Reforestation and Education Project. That was designed to respond to rapid degradation of the village forest land. The project, as it started, it was planned to answer the issues about tree planting and replacing the lost forest at the beginning, and it worked with the individual villages. But 5 years later, it was seen like working with individual villages cannot work out. So it was expanded and reviewed to address ecosystem-based conservation, which later in 2005 was again reviewed to address landscape level conservation. And it's under this conservation level landscape level idea, that we have come up with the landscape conservation in Western Tanzania project that started 2 years ago. And it will continue up to 2023. Yes. Next. Okay. Yeah, but all in all, as we started working with people, we faced some issues that made us rethink about the way we plan our projects. We went around and we wanted people to participate. Of course, we were working with people in villages, so we wanted them to be the core participants in the project. But when we started the project, we realized that from their feedback, especially from the participatory rural appraisal assessment that we did in 1999, that environmental degradation was not their key issue. They had some other important issues, and those were health, access to health, education, water, and capital to do business. So that made us rethink about the way we do, we plan and operate this project. Of course, the issues of poverty and disease were cross-cutting that. This is a typical village in Western Tanzania, and it's a village immediately north of Gombe National Park. So you can see the hills behind the village used to be chimpanzee habitat, but over time and in growing population, all the vegetation and all the biodiversity were then lost. So this is one of the villages that created cutoff in between in between forests. Now, there is some kind of a vicious cycle. Why? Because people depend on forests. Those are the natural resources that are readily available for their use. And they don't intend to distract them. They intend to create revenue out of them so that they can sustain their life. But with rapid degradation and the ultimate soil erosion and low crop production due to loss in soil fertility, once the soil is bare and you get the rain, the topsoil is washed into the lake. That means you lose all the fertility. So low crop production was imminent. And then the habitat loss for the wildlife is an issue that came on because of the fragmentation. And why, again, is because of the rapid population growth. We all know that Kigoma used to receive, the Western Tanzania used to receive refugees from Congo and Burundi. So there was a time when our population growth grew up to 4.8%. Of course, our natural population growth is 2.9%. And so our population kept growing. Next. So considering all those issues, the JGI, the Legion Goodwill Institute, reorganized the way we think about an integrated approach. And this is what forms TACARE. Of course, at the center of everything, we are thinking about sustainable natural resource management. But again, we cannot do it without involving family planning. In this case, we invited Pathfinder International to contribute to family planning. Land use planning has been a cross-cutting issue that is the basis for our natural resource management, because people have to know have to plan for their land uses. And then sustainable forestry and natural resource governance and socioeconomic development, as my colleague have said. We also operate COCOBAs and VICOBAs, which are community banks. Next. The community banks are aimed at providing alternative source of income. There are a lot of human-induced pressure on the environment in our case. If you see at the map quickly, this is almost the map of the area where we serve. And Gombe is really tiny on the lakeshore in the northern part of this map. But the rest of other land used to be general land and has recently, through our facilitation, been categorized as the local authority forest reserve. And there are three of them: Tongwe East, Tongwe West, and the Masito forest reserves. Now you see the blue dots, those are the livestock areas observed during one of the aerial survey. And then the brown is about residents, new homes for people. So you can see that it's all mixed up. Even in the center of the chimp habitat, there are livestock and there are people living in there. So the issue of people and livestock is really an issue that we are addressing because people are part of the ecosystem. So we have issues like conversion to farms, and then settlement expansion, overgrazing, and logging and charcoal production as the key threats. Yes. Over years, we have seen the advantages of having a PHE because as a research organization and a wildlife conservation organization, people could not really trust them. So when we included family planning into our operations, it created credibility to the people. So we could easily talk to people because they knew that we care about their other problems. So it's cost effective, saves time, insists for beneficiaries instead of going one time for one agenda and next time for another agenda. And it helps in resource sharing, like what my colleagues have said, and enhances acceptability. And PHE, in fact, mirrors the way community interacts with the environment. Next. This is a research framework that integrates population and health and family planning. Actually, it's a population, our strategies, there are two strategies in yellow, which is promote healthy families. And the second one is promote a sustainable natural resource management, as I've said earlier. And you can have a look at this at your free time. It's a complicated diagram, I'm sorry. Next. So we have done quite a lot, but in short, let's say that we are building the capacity of the local government to support effective natural resource management, but in a PHE way. We are training a number of people, a number of categories, and we are also doing land use planning, but it's all integrated with family planning. Next. Next. You skipped one, please. One back. Yes, thank you. So, and we have community monitoring. We've set a system of community monitoring using GIS and GIS and remote sensing. And then we have, as I said earlier, we have reproductive health, which is family planning, where we use the community health workers and PHE to integrate the PHE among the people and the community. Next. So the environment, we have adopted the BCC approach to promote environmental management and family planning as well. Next. So this is the end of my presentation. I just wanted to have a quote from Jane that insists on, if you want to succeed in conservation, you have to include people around the wilderness that you want to conserve. So we are basically conservation NGO, but we have adopted the family planning, integrated the family planning into our work for many reasons, as we have seen before. But I cannot conclude this presentation without thanking the American people for their support that has made us achieve the results we have achieved so far. Thank you.
Thank you very much, Mtiti, and thank you to all of our panelists for sharing these various interesting and impactful initiatives across Tanzania in integrated development. We'd now like to take a few minutes to address some of the questions coming in from the audience. So I will ask panelists to please keep your videos on, and I will field some questions specifically. I regret we won't have time to address all questions, but we will try to address a few of them in the time we have remaining. The first question to all panelists, but I think more specifically to Angelo and Mtiti around the integration of issues in terms of population health and environment in messaging. Did you find that in communicating with the communities that the integration of the issues made messages more resonant with the audience?
If I can start. Yes, yeah, that's true. That's it. That people have many problems, and you have to address them in a way you think is relevant. Of course, you cannot address every problem because then you will not you lose your focus. But in such a case, yes, integrated messages are very important and they make a lot of sense. In JGI experience, for example, people thought like we are playing tricks around them, that we want them to conserve their forests, and then they will be relocated to give way for the biodiversity for the chimpanzees, for the habitat for the chimpanzees. It happened in Gombe when the Gombe National Park was established. But then when we had integrated messages, so they were like, oh, no, it's only about the forest. It's also about our own cause.
Wonderful. Angelo, would you like to add anything to that?
To add on what Tito was saying, issues of messaging is very important, just like he said. Again, we have been trying to make some sort of job aid for our providers at the community level to see how they can best present this kind of messaging. So, for instance, in our ENT landscape, we are working on the simple job aid where our PhD champions can move around and give all messagings accordingly without mixing them or without misinterpreting them. What I've been doing at a field level. Thank you.
Wonderful. That sounds like a helpful approach. Thank you. A question quickly for Judith, and apologies again at not being able to finish all of what we were speaking about earlier. Judith, could you tell us more about the greatest challenges or what you anticipate ahead for the implementation of the National PHE Strategy in Tanzania? Judith, it looks like you might be muted. Are you still with us?
Yeah, I'm here.
Great.
Most of the challenge we encountered is the long process for development of the strategy, because it was supposed to be launched last year, but until now it is in the higher authority waiting for the approval. So at least it has passed through all levels, getting all the comments from most stakeholders from both parties in Zanzibar and Tanzania mainland, in all the projects which are dealing with a PHE. But now the challenge we have is that just the process of getting the approval. It's not really easy because there's a lot of strategies which have to pass through the interministerial technical committee. So we are just on the queue. That's the challenge we can talk for now. So it is at advanced stage waiting for that approval. So once the approval has been done, that is where we can develop a resource mobilization plan for the implementation of various interventions. Thank you.
Thank you so much. One more question, a bit more generally, is if girls' education is a component of population health environment. And I'm sure we have some panelists who can speak to that or give some examples.
JGI operates a girls' scholarship, but we put it under environmental education or whatever kind of education. We sponsor girls from poor families for starting from secondary education up to college level. And we hope that the more land they are, the more they will understand about conservation. So, and because the way we sponsor the girls, it brings us closer to the community. It makes our relationship to the community much stronger. So to give us the area to talk about environment. But we don't specifically, it's a component of the Takare project, but we don't specifically consider it as a component of PHE. Okay. But it's within our education reach or plan.
Okay, so it sounds like at JGI, it is part. Yes, go ahead, please.
Yeah,
sure.
Additionally, girls' education is one of the criteria for the model BOMA program in our landscape. So it is falling under integration criteria. So for somebody in a BOMA who is having girls, we also encourage them to take them to school, especially in this landscape we are working. Other partners whom we're working with, like Tanzania People and Wildlife Fund, they have a scholarship program for both girls and boys. So Pathfinder in the program has been also making some referrals of those who are in need of education to this organization. TPW is also part of the ENT organizations to take the boys and girls to school. Thank you.
And also, Tessie, maybe to add on that question, at the higher learning institution level, the program which we are about to launch after approval also has causes related to gender, which also champion, girls' education, especially on PHE itself. So we have gender in population health and environment as one of the causes, which is very, very crucial, and actually it's a compulsory cause, so as to enrich, knowledge around the issues related to gender, and specifically empowerment of women and so forth, in PHE, kind of interventions.
Thank you so much. I appreciate you're all weighing in on that. I think we have time for about one last question. So I see a question here, perhaps more for Angelo and Mtiti, but please weigh in, other panelists. In working with community health workers, how do you educate community health workers to a PHE approach?
It's all about an integrated curriculum. The government curriculum for PHE, it used to be the one, community health workers, used to be the one that only focused on family planning and reproductive health per se. But as we train them now, we integrate that with environmental conservation topics. It feels like people have, even them, because the community health workers are part of the villages, are part of the communities they come from. They feel the problems and they feel the importance of family planning. In the area where we work, there is an average of 7 people per family. And they feel the impact that the population is posing on the environment. So they feel that in terms of firewood collection, wildlife disappearance, there are some of the villages where landslides were an issue. So they feel those. So integrating them together makes more sense to them. However, even if you go with a separate Cylon project, you will still face the same person. So that's what we missed at the beginning. If you go with health, if you go with agriculture, if you go with everything, you will still go to the same person. You don't divide people in villages. So that's what we have adopted. And we looked at all the problems that face the people, and we had to see where can we address the problem. And we realized immediately that population management or the issues of population is an area that we can intervene and make sure that we address most of the issues. Once the population is managed, they can take care of themselves and take care of the environment. And, yeah, thank you.
Thank you very much, Mtiti. I regret that we've run out of time, but I'm so glad we got to answer some wonderful. Oops. If you wouldn't mind, Alfred, passing to the last slide. Thank you again to all of our panelists and all of those of you who have joined us today. We hope you've gained valuable insights and encourage you to keep the conversation going. Join us to follow updates through the Global PED listserv, follow @AfricaPHE on Twitter, and check out PRV's People Health Planet work on our website, and look out for other upcoming webinars in this series that will tackle other questions related to PED. As a reminder, this webinar has been recorded and will be shared with all registered participants as well as shared through the channels here. So a big thank you again, all of our panelists. Thank you, stay safe, and have a wonderful rest of your day.